My name is Segun Ajayi, and I'm the CEO and founder of Hospitals for Humanity. We began Hospitals for Humanities maybe when I was in medical school. The full concept of it kind of flourished about 6 years ago. We're based out of the U.S. We're a 501c3 organization. The itch started probably when I was like 19 or 20. I came back home to Nigeria, and I was hospitalized.
Wow.
And it was because I had I wanted to be like everybody else and drink the local water out the faucet. And the next thing I know, I was vomiting, diarrhea, and it was whatever. And then they took me to the hospital at supposedly one of the best hospitals in Lagos, and I was unpleasantly surprised at the quote-unquote better hospitals that we had in Nigeria. So it was at that moment that I decided that this was not going to be the story of Nigeria in healthcare. We have a better story to tell. It took us 5 years to plan it. I mean, 5 long years, several different methodologies, several different models, several different ways in which we would think that we would have the best outcome. It takes a lot of planning. It takes the concept is one thing, but then you put that concept on paper, and then implementation becomes another thing, especially in an environment like Nigeria. I am a strong believer in Christ. So my conviction is that the only reason why this is even sustainable in the way that it is now is because I recognize that this is way beyond me, and this is way beyond the people of Nigeria. It is so much bigger than that. I think it's a movement, it's a change, and you really have to be able to understand that concept before you do anything. Practically, we're looking at, you have to fundraise, you have to get people like Dr. Bumi Ode, like Dr. Ikena, who believe in your vision that will help keep the sustainability there. Also try to partner with state governments. So state governments who have the vision of healthcare, who understand what we're doing. And one such government is the Plateau State governor. He bought into it immediately. They sponsored 10 children, and they're even looking to sponsor more children. We have worked with NHIS as well, National Health Insurance Scheme. They sponsor. We petition corporations. We let them know what the vision is. Look, these children, 80,000 children a year are born with congenital heart disease in Nigeria, and we're doing less than 100 surgeries per year in Nigeria. That is crazy. I'm completely sold out to these kids. I am dedicated to those children, and whatever we have to do to get these kids. Structured capacity building, meaning putting fellowships for fellows together, a full residency program, not just for the doctors, but for the nurses, for the perfusionists, for the respiratory therapists, the whole thing. And we really have to now, it's like we're starting over again. We've reached our first goal. Now our other goal is capacity building within Nigeria. We know that $1.2 billion in the year 2014 went to India just on medical tourism. So why can't that money be funded back into the Nigerian economy? And so I'm after that 1.2 billion to put it back into the Nigerian economy. We really try to partner with governments, because then they have the structure there that we can grab students and say, okay, you're going to be on this path for the next 6 years. By year 6, you're going to be able to do pediatric surgery in your state. Or a nurse who wants to be a pediatric open heart nurse, you're going to be on this path for the next 2 years. You're going to get international certification. You're going to be able to see how it is to run a code by yourself. If you don't have the physician there with you, you will know what to do. So these are the things that we really, really strive on. Yeah, and that's the story of Tahir. Tahir is it's an amazing story. He was a child who had teratology of Fallot. We have been talking to the mom preoperatively. He got into surgery and he basically died on the table. Ikenna called me in, Segun, and as he's talking to me, he's pumping the heart. Segun, we're massaging the heart, and I'm looking up there in the monitor, and it's really like a dire rhythm. Segun, have to tell the parents that we are experiencing some complications, and Tahir probably won't make it. And he said, and this is what really gave me the respect of Ikenna. He said, but I'm going to continue on working on this kid. So we went out, we spoke to the mom, and as plain as day, the mom said, he's not going to die. So here I am, I see Ikenna who's telling me Segun, and then I come out and he's not going to die. So, okay, but I'm just telling you this is the situation. Ikenna called me back in. Segun, we're still working on him. There was some issues with the electricity. It was, at the same time, he has the chest wide open and he's still pumping the heart manually with his hands. And so I said, okay, so 20 minutes later, he called me back in. Segun, his heart is pumping on his own and he has a normal heart rate. And, but it's still a very dire situation. So about 5 hours later, Tahir comes out of surgery in really critically ill. At that point is when we heard of this newly graduate pediatric intensivist who just moved to Lagos, and we probably want to talk to her. And she graduated from Harvard, and so I was like, let me call her now. So this young lady got on the phone by the name of Dr. Bumi Ode, and she was like, hi, what's going on? Oh, I was like, Bumi, can you be here tomorrow morning? Oh, I'm not doing anything. Sure, I'll be there in the morning. We booked her a ticket. She came in. By this time, Tahir had a CVA. He had a stroke, a left-sided stroke. He was posturing. He was his kidneys had stopped functioning. And by the end of this whole ordeal, Tahir is walking, talking, no sign of any deficit whatsoever. He's running around. I just saw him in November, and he is doing excellent. So that is the story that always keeps me going when we talk about this open heart program.